Hello everyone, this is Venus Senior, aka your patient account detective. I'm coming on tonight to share some information with you about the explanation of benefits. It is also called an EOB. Okay, so if you ever hear that term, EOB, just know that it is the same as an explanation of benefits, okay? And it's just what it states, an explanation of benefits, all right? And so what happens is, I want to go over with you in regards to this document because I want you to understand how to read the document, all right? It's very, very, very important that you understand how to read the document because this is what can help you find money. All right, find money that you overpaid and even save money so that you won't pay something that you're truly not responsible for. All right, and so here I just want to show you, this is a real live explanation of benefits, and this is from my insurance carrier, and I just wanted you to see some of the information that's contained on here. I did block out some personal information, but for the most part this is what an EOB looks like, okay? And if you can see here, you see it also tells you it's an explanation of benefits. All right, so I wanted to go over this document with you so that you could have an idea of the information that it entails and what you should be looking at when you actually receive this document. All right, so I just want to kind of make sure that you can see all of the content there. All right, just moving it around so you can see. And I'm actually going to do another video, hopefully I can do it live, and where I can actually go through this so you can visually see it. I want to write all this stuff out so that you can see and we can talk about in depth what it really means, okay? So you guys see that? I just want to make sure that you get it. And I definitely want you to see that down there, okay? You see all those numbers? Look at that. So all of that actually means something, all right? All right. So again, this document is your explanation of benefits, okay? It's not a bill. It's an explanation explaining to you what you owe and do not owe the healthcare provider, all right? And so it's a lot of information that's contained on this document. For one, it gives you the name of the company, all right? The name of the company in which your insurance is held through, which mine is UMR. So some of you guys may have Aetna, Blue Cross, Blue Shield, United Healthcare, and there's so many other names out there, but that's just to name a few. This document will also give you the mailing address where you can communicate with your carrier. It gives you the phone number where you can contact their customer service department in case you have questions. All right, and on this document it will tell you the employee's name, the member ID, the patient name, which may not be the same as the member name or the member ID. It will tell you the date that they sent the notice out to you. And it may give some other additional information such as employer name and the employer number, okay? Also, it lists here the provider name. That is the doctor that rendered services to you or the facility that rendered services to you, okay? That is the provider. Also, we have here the patient account, all right? That's very important. Patient account is the number, the identifier that you want to utilize when calling your insurance company if you have questions on a certain claim that was submitted to them, and or the document, the explanation of benefits that they sent to you. You want to give them that patient account number, because that will help them to actually bring up that exact claim that you have in your hand. That is the charges. When I say claim, that also translates to the charges that was submitted to them for that particular data service. All right. Also, we have the claim control number. All right, that is utilized by the insurance companies and sometimes the healthcare providers when they are communicating with one another. That's typically, they may ask the patient, for that in some instances, but it's more so mainly for the doctor and the insurance company communication. All right, and so now we're going to talk about some of the detailed, I call it field locators, that are contained on the explanation of benefits, and this kind of gives information of what type of charges were received and how they were processed. Okay, and so we're first going to start with the description line. All right, and I know you can't see this, I just wanted to verbally go over it, but when I do the next video, I'm actually going to handwrite this out and have a visual for you as we talk about it, because this is very important. We can talk about this day after day after day after day, and it still will very much mean something that is very important, okay, for the patient and the provider. All right, because this document, again, it lets the patient know what they are responsible for. All right, and it will help you to save money, meaning you you get a bill and you really don't owe it, but you were going to pay that bill, but based on this document that you received, this document will let you know, no, you don't owe that. Okay, or maybe some additional information is needed, and either the patient or the provider needs to get that to the insurance carrier so that that claim can be processed. All right, so we're going to start off again with the service description, and that is actually telling the patient and the insurance company communicating, this is the charge that we received, describing the type of service you had. All right, so my service is stating that it was a medical examination. All right, and then we have dates of service, from and to dates. All right, it gives you detailed information about the charges that were submitted to them. All right, so we talk about the dates of service. Again, it is the from and to date, meaning the date that you were seen and when that service ended. It may be the same day, or it may be a date range. Okay, it just depends on how long that service was rendered. If you're just going in, let's say for a exam or annual checkup or a preventative visit, most likely that will be just a single date of service. But let's say that you're admitted into the hospital for 3 or 4 days, that is when we would see the difference, and we would see the date range. Okay, so that will be, let's say if you went in, let's say February 1st, and you stayed until February 3rd. All right, simple enough, right? Date range. All right. So the next field locator on here, again, is what I call it, is called the amount billed. All right, so this is the amount the charges were sent to the insurance company. This is how much was charged for the service that was rendered to you. For my medical examination, the amount billed was $115. Okay, this is considered also the total charge billed. All right, I just have one charge service description on here, so for me it's just going to be that $115. But let's say there were other services that were rendered here, like a office visit, or if there was a procedure done, you would have multiple line items with different charge amounts, and so that total amount billed or amount billed would actually be more than just that $115. Okay, and so then the next column we come to And let me just turn it around so you can see it to get an idea. Okay. And let's see. Alrighty, and let's see. So you see here where it has medical examination as the description. Then it has the date of service. Okay, you see that date range? 1 day, right? All right, and then you see the amount billed, which is the $115. Okay, and then so the next line item, or I should say the field locator we have, it states that it is a C note section. So this is actually your remark code section. All right, and that code that we have in here is a 908. All right, that code means something. Okay, that is a remark code that gives information about certain charges that are on the bill. All right, and so we want to look at that closely because that also can save you money and help you find money. All right, so that remark code that we have on here is going to be actually, well, let's back up, okay, because I do see we skipped a category, which is amount not payable. All right, and that will lead us into the remark code. So the amount not payable is the next category that is after the amount billed, and that is showing at $63 and what is that, 40 cents. You see that? 63.40. Okay, all right, and that amount actually states that it is not payable. It states amount not payable. All right, and when we go back to the section note or C note section, because they're called different things, it depends on what insurance company you are what insurance company you have. The lingo is a little bit different, but it all reads the same. It means the same. All right, so we have a note section on here. It says C note section 908. So then when I go look at my explanation of benefits here, if you look at the bottom here, you see that it has note section. All right, and what it states is, it states provider negotiated discount. You are not, okay, I'm gonna say that again, you are not responsible for this amount. Your claim was processed at the in-network level of benefits. Okay, in-network level benefits. All right, so that means you do not owe that amount. This section you want to make sure you pay attention to, all right? Because a lot of times this is where patients get billed for this amount and they do not owe it, okay? I'm going to say it's done in error, inadvertently, all right? So a lot of times the claims are not posted manually, and in that retrospect, when it's not posted manually, sometimes these amounts that is not the patient responsibility, it doesn't post to the correct area, and that then triggers a bill to go out to the patient in which they do not owe. All right, and now the next field locator we have on here, it is less deductible. Can you see that? Less deductible amount. Okay, you see that? Less deductible amount, and that amount is $51.60. So anytime you hear anything about deductible, copay, or coinsurance, just know that that is the patient's responsibility. All right, so here we have $51.60. That would be the patient responsibility. Okay, and then I don't see the next category is copay. There's no copay amount. We have allowable amount, that is $0, and then we have the planned benefit amount. Then we have the amount paid. Both of those field locators are $0. And then we have what's called the provider may bill you. Okay, so sometimes it's called provider may bill you. Sometimes it's called patient responsibility. Okay, or sometimes you may just see the PR, which ultimately means patient responsibility as well. Okay, so those are some of the key terms just to keep in mind. And then that's pretty much the overview of the explanation of benefits. But like I said, I want to write it down, so that you can actually see a visual on, so you can look at it and see, because I know I'm flashing a paper around and it is, a real life document, but it also helps. I'm a visual learner. So I like to see things, and I grasp both, but I'm really a visual learner. So I think it would be very important and beneficial if you can actually see it and not just only hear it, but I can walk you through what you need to look at when you're looking at your explanation of benefits. When I say that this is vitally important that you understand this, okay, it is vitally important. All right, it is so important. Why? Because this document will help you to save money. Okay, that is not put out or pay out money that you do not owe. This document will also help you find money. Okay, so money that you already paid, and we'll get into that a little bit later as to why you would even pay it in the first place. But this document will help you find money, because let's just say you paid for something. In this case, I did explain to you that it stated on my explanation of benefit that I did not owe the $63.40. But let's say I just got that bill and I just paid it. Guess what? When you get your explanation of benefits, you can match it up and you will see that you did not owe that portion. All right. And then it's necessary steps that you need to take, and you need to know how to take them in order to get your money back. Okay. And that's where we focus on finding the money. Again, explanation of benefits are so important. Okay, so important, because it gives you information. It gives you information. It lets you know what you do and do not owe the provider. Sometimes, just as a patient, us looking at the document, guess what? Sometimes we have to reach out to the provider and let them know, because sometimes, again, the systems, some systems post electronically, and they may not catch it as quick as it should be caught. Sometimes they may not catch it at all. So if you don't catch it, they don't catch it. Who's going to catch it? All right. So I really want you guys to get this. I am a patient advocate. I am a provider advocate. And I just want to make sure that, one, patients, you're being billed correctly, and that is what you truly owe. And providers, I want them to receive their total maximum reimbursement for the service that they have rendered to the patient. And I just want them to bill the patients correctly, okay? It's a cycle. It's a cycle that we both, the provider and the patient, both need to be educated on and stay up on, what's going on, okay? Because there's trends that happen with this, and, it changes every day. It changes, seemingly changes every day. But you really have to pay attention to this. When I tell you it's so important, it's so important. And even if you think, I don't need this education, let me tell you, maybe you don't. At least not right now. But you have family, you have friends, you have children, you have, just about everybody. I mean, everybody needs to understand this, because some point in your life, you're going to deal with this, or you're going to know someone that is actually, maybe they're not having a challenge, but it's always good to be educated so that if something comes up, you'll know how to navigate this thing, okay? And so I'm going to get ready to get off, but again, I am going to do a video in where I actually walk you through. Hopefully it can be live. I got to get some more equipment so that I can, really stream these or do these videos live where I don't have to hold my phone, okay? But at any rate, I'm going to make sure you guys get understanding, okay? I am going to make sure you get the understanding. So this is Venus Senior, aka your patient account detective. Remember, patients get care, providers get paid, and all you're getting, get understanding. I am dedicated to your understanding. I will see you soon.